For 20 years, the opioid crisis functioned as a slow-motion national disaster. As the death toll surpassed 1 million people, the public expectation remained firm. The architects of the epidemic would eventually pay a heavy price. This figure suggests that reckoning has finally arrived. State and local governments have secured $57.8 billion in global settlements against pharmaceutical manufacturers, distributors, and consulting firms. We saw the guilty pleas. We watched the news cycle announce the fines. It looked like a rare moment where the justice system successfully held massive corporations accountable for a public health catastrophe. Look past the headline numbers and into the fine print of the payout distribution. The pharmaceutical executives who drove the crisis are largely keeping their personal wealth, while the actual victims of the drugs are finding themselves systematically shut out of the settlements. The system has produced a massive financial exchange, but it is also providing these corporations with a repeatable playbook to avoid genuine liability. The first play focuses on neutralizing massive judgments through the appellate courts. The blueprint for this maneuver was written during the Ohio pharmacy trials. In late 2021, 2 Ohio counties won a $650 million judgment against CVS, Walmart, and Walgreens. The jury found the pharmacies liable for the oversupply of opioids that were diverted into the community. The counties won by using public nuisance law, arguing that the pharmacy's failure to stop suspicious orders created a direct threat to the health and safety of the public. However, a federal appeals court recently wiped out the entire $650 million award. The court ruled that public nuisance laws cannot be used to penalize the sale of a legal, regulated product. When trials produce a verdict, the playbook moves to the bankruptcy courts. This allows corporations to take a settlement they've already agreed to and unilaterally slash the payout through restructuring. The drug maker Mallinckrodt demonstrated how this works by filing a second bankruptcy just 14 months after their first. This maneuver allowed them to legally walk away from $1 billion in opioid settlement obligations they had previously promised to pay. These legal strategies, appealing the basis of the law and utilizing Chapter 11, ensure that even when a company is found liable, their survival is prioritized over the actual compensation of the people they harmed. The second play protects the firms that engineered the crisis from behind the scenes. This involves the management consultants who built the aggressive marketing strategies used to push OxyContin into the market. In 2013, McKinsey & Company advised Purdue Pharma on a plan to turbocharge sales. They specifically suggested focusing sales efforts on high-volume prescribers who were already writing massive quantities of opioid prescriptions. McKinsey's internal notes from the time showed they were aware of the consequences. Consultants reported that pharmacists in the field were shaking with fear over armed robberies and rampant drug abuse. The Department of Justice eventually charged McKinsey for their role in the crisis. The firm agreed to pay $650 million to resolve criminal and civil investigations into their work for Purdue. Investigators also discovered that a senior partner at McKinsey intentionally deleted files and emails to obstruct the federal investigation into the firm's opioid engagements. For a global consulting giant, a $650 million settlement functions as an entry fee. It allows the firm to pay the fine, acknowledge an isolated obstruction, and continue its operations without dismantling the machine that produced the strategy in the first place. Follow the $57.8 billion as it leaves courtrooms and drains into the budgets of 50 state governments. State officials accepted this money under a strict condition: 85% must be used for future opioid remediation and recovery services. Tracking has revealed that only a handful of states are providing clear reports on this spending. In others, the money has been used to buy police cars, pay for general government salaries, or simply disappear into general funds. This government windfall stands in stark contrast to the families who lost children or exhausted their life savings on years of rehab. Nearly 140,000 victims filed personal injury claims in the Purdue Pharma bankruptcy alone, seeking some level of financial recognition for their loss. Most will receive nothing. Trusts are currently rejecting over half of these victims, often for missing bureaucratic deadlines or failing to produce decade-old pharmacy receipts that no longer exist. The result is a framework that successfully funnels billions into municipal budgets, while building a wall of paperwork that keeps the families who were ruined by the drugs on the outside. In 1998, the big tobacco settlements were pitched as a final moral reckoning for a deceptive industry. We are hearing that same language today regarding opioids. But after 5 years of litigation, corporate wealth remains shielded by bankruptcy and appeals. While municipal budgets are bolstered by new settlement cash, the public anger over executive wealth remains. These outcomes are not a failure of the legal system to produce a result. They are the result of a system where the rules of bankruptcy, corporate liability, and public nuisance are specifically structured to prioritize institutional continuity. By focusing on protecting the regulated product and the survival of the corporation, the law naturally funnels restitution toward governments and away from individual human beings. We have won the largest legal settlement in history, but if the money stays in government coffers and the victims receive nothing but rejection letters, we have to ask who that justice was actually for.